My topic is WASH in refugee camps. The purpose of this presentation is to describe where refugees are living and what factors may impact the health of refugees, focusing on water, sanitation, and hygiene, which is also known as WASH. I will look at the relationship between WASH-attributed mortality and diarrheal disease, first globally, then in a camp-specific site, and finally in the vulnerable population of children. I aim to highlight the importance of the role WASH plays in reducing mortality in refugees, primarily by reducing rates of diarrheal disease. Here's a table of contents. I'll start off going over the top 10 refugee camps by population. Then I'll describe key WASH indicators. Moving on to global deaths attributable to WASH. I'll describe deaths in a Sudanese camp attributable to WASH. And then finally I'll go over diarrheal disease and child mortality. So to start off with a definition of terms, a refugee is a person forced to flee a country because of persecution, war, or violence. There are currently 25.4 million refugees, which makes up 1% of the global population, half of which are children. 2/3 of refugees come from just 5 countries: Syria, Afghanistan, South Sudan, Myanmar, and Somalia. Turkey hosts the largest number of refugees, with 3.5 million people. Other major hosts are Pakistan, Uganda, Lebanon, Iran, Germany, Bangladesh, and Sudan. They're planned as temporary settlements, but many have developed into fully fledged cities. The refugee camps listed here, most of which were established in the 1990s, but Katoomba in Tanzania was established in 1972. So they're planned as temporary settlements, but they may last for decades. And so I've listed the top 10 refugee camps here to give you an idea of the geographic location of the camps, the cultural heterogeneity, as well as the population density, which is an important point to note when it comes to inadequate water, sanitation, and hygiene. Key WASH indicators. So fecal oral diseases can grow to epidemic proportions when people in crowded conditions, such as refugees, lack clean water for hygiene and sanitation. So it's less of an issue in higher income countries, but worldwide, only 19% of people are estimated to wash hands with soap and water after defecation. So as an example of how diarrheal diseases may spread, diarrheal diseases result from a variety of environmental and behavioral factors. So farm animals in and around the refugee camp may defecate near or in a water source. People without proper sanitation facilities, such as latrines and toilets, may defecate in or near a water source. Later downstream, farmers use this contaminated water to irrigate crops, or people use contaminated water for drinking or food preparation, and ultimately contaminated food and water is consumed. So this table shows the core measures used by global health actors to track and evaluate water, sanitation, and hygiene. So the key indicators are water quantity, so how much potable water a person is getting per day; water access, the distance of a water collection point from housing; water quality; sanitation, the number of persons per toilet and latrine; the percent of households reporting defecating in a toilet; hygiene, whether people have access to shelter and showers; community hygiene promoters; and finally the percentage of households with access to solid waste disposal facilities. So all of these core measures ensure that the water is not being contaminated, and that clean water is being provided for refugees. Next, the global deaths attributable to WASH in 2016. So 3.3 of global deaths are attributable to inadequate WASH, sub-Saharan Africa being the largest share of the disease burden. Of WASH attributable deaths, diarrheal disease make up 44%, or 828,700 preventable deaths. 35% of deaths due to diarrhea are attributable to inadequate drinking water, 31% to sanitation, and 12% to hand washing. Water management, which is the next largest cause of death, is comprised of deaths due to malaria, cholera, and onchocerciasis. To show the impact of diarrheal disease, specifically in a refugee camp, I have a graph here showing the deaths in Sudanese camp. 240,000 Eritreans and Tigrayans left Ethiopia and sought assistance in Sudan between October 1984 and April 1985. This graph reflects the emergency phase when the refugees first arrived at the camp. So as you can see, throughout this day, diarrheal disease remained a major cause of death. Even in July, at the lowest point, diarrheal disease was responsible for 720 deaths that month. So lastly, I'll go over diarrheal disease and child mortality. Though WASH attributable deaths globally account for 3.3% of deaths, in children the proportion of deaths from diarrhea alone are 3 times that, at 11%. So diarrheal disease kills 2.2 million globally each year, most of which are children. Key measures to treat diarrhea include access to safe drinking water, improved sanitation, good personal and food hygiene, appropriate vaccination, and health education. So in summary, refugee camps are highly crowded and populous settlements which lack adequate water, sanitation, and hygiene, resulting from limited resources in the setting of violence and war. Inadequate WASH is a significant cause of death in mostly low and middle income countries. This problem is amplified in vulnerable populations, such as refugees, and even more so in children, which comprise nearly half of the refugee population. Diarrheal diseases are a major component of WASH attributable deaths and can be addressed through increased access to safe drinking water, improved sanitation and hygiene, vaccination, and increased education on healthy behaviors such as regular hand washing with soap and water. And so here are my references for further reading, and that concludes my presentation. Thank you for listening.